The number of confirmed measles cases has risen to 169 across 4 provinces. This is according to the latest National Department of Health figures. The Northwest, Mpumulanga, Limpopo and Gauteng have reported cases, and further spread is likely with the increased movement of persons during the holiday season. Now, measles is a vaccine-preventable disease, but can be deadly, particularly for children who have missed routine childhood immunizations. Let's talk a little bit more about this. On Zoom, we are joined by UNICEF South Africa's Chief of Communications, Toby Fricker. Toby, good to have you. Thanks so much for being with us here on the program.
Thanks so much. Good morning.
So we talk about an outbreak, and I mean, an outbreak is sort of a big word. How do we come to the word outbreak? And perhaps you can paint a picture of how dire the situation is in South Africa.
Yeah, Sean. No, thanks so much for having us. I think, an outbreak, I mean, if there's one case, essentially we have an outbreak. And the reason we say that, or the reason the Department of Health and health officials say that, is because we know that if there's a case, then there will be spread to some degree. And what it really does is it enables us to then try and respond as quickly as possible to try and stop that spread, to contain the spread as quickly as we possibly can. So that's why we're talking about an outbreak, and we have 169 cases now. And as you mentioned, we're of course in the holiday season, people are moving around the country, and the likelihood then is that measles will spread further.
Mm-hmm. I mean, and we talk about the fact that we've got 169 cases. Just perhaps give us an understanding, in comparison to where we usually are. I mean, getting measles under control is something that obviously many countries have managed to achieve because it is a vaccine-preventable disease that we can stop it in its tracks. But 169, when was the last time that we had so many cases reported in the country?
Well, yeah, you're right. I mean, the thing with measles is we can stop it, and usually we don't have outbreaks. That's why we're talking about this outbreak, because we've got to, nearing up to 200 cases, and that is a concern because measles moves quickly. It's very contagious through coughing, through sneezing. It can stay on surfaces. The virus can last on surfaces and be passed on quickly. And what we do know is in South Africa that there are 100,000 zero-dose children. And that means children who haven't had their routine immunizations from birth. So we know there are gaps there in the system, and we really need to try and get that outreach there so people are aware of where the status is of their children's vaccination, and to try and get that up to date as quickly as they possibly can.
So let's talk about the age groups that are affected right now. We'll get to the issue of the vaccination, but when we talk about the outbreak where we're nearing 200, what are the age groups we're looking at here?
Yeah, so we have children mainly who are affected up between 5 and 9 years old, and that's around 44% of all cases. And then you have children from 1 to 4, and that's around, I think it's 28% of cases. And then the rest are from, upwards from 10, actually up to 42 years, because of course adults can catch measles as well. So that's the sort of breakdown of ages, and that's pretty normal, I think, what you see in any measles outbreak anywhere. But the critical thing is to get the youngest children vaccinated quickly, because they are the most vulnerable. And that means getting your first dose at 6 months and the second dose at 12 months. Because children at that age who haven't had their doses are most vulnerable to the virus and can be hospitalized, and it can be fatal.
Mm. Now, the outbreak that's currently happening now, I mean, is there any way of telling if the people that have been affected have in fact been vaccinated against measles? Because it's quite a wide range. It's not just children we're talking about adults as well.
Yeah, that's right. And the National Institute for Communicable Diseases, the NICD, does have that data. And what's interesting, actually, is we're seeing a large number of patients, or large number of cases where we actually don't know the vaccination status. And that is an issue, of course, because that data should be clearer. And that's an area that we really want to advocate to try and improve as quickly as we can. And when we look at the Road to Health booklet, the excellent booklet that the Department of Health have at health facilities across the country, that's really the place where we vaccination status, and making sure that's up to date, making sure people are aware that booklet exists and that they can access it. It's free to take from health facilities. Is really important, because that can help broader data so we can understand how many are vaccinated and how many are not.
But
right now, a large number, we don't have that data, and we really need to sort of dig in a bit more to understand.
Yeah. Is it ever too late to be vaccinated? I mean, that's an important question, because some parents might be watching now and saying, you know what, I've actually never vaccinated my child for measles, and they are now whatever age they are. Is there an age limit, a time frame?
No, there isn't. That's a really important point, that for measles, you can get vaccinated at any age. I mean, the ultimate vaccination is at 6 months and 12 months of life, but you can get vaccinated at any age, so it's never too late, which is why it's so important for parents, for caregivers, to check that status, to check whether they've had that immunisation, and if not, then to access the local health facility and to get vaccinated.
So quite fascinating that a lot of the cases, the people are actually vaccinated. I mean, I'm just looking at one province, for instance, in Mpumulanga. They're saying that of the 50 cases, 31 had an unknown vaccination status, 8 were vaccinated, and 11 were unvaccinated. So again, is it the theory that if you are vaccinated, you still can catch it, but won't be as severe? Is that what we're looking at?
Yeah, that's right. You can still catch measles, but it will not be as severe, and you're also less likely to pass it on again. As a child or as an adult if you catch the measles. So you're absolutely right that there are a number who have been vaccinated but can still catch measles, but it's much less severe, and really will stop any illness developing into sort of potentially going to hospital. And that's particularly important, like I said, for the youngest children who could be most vulnerable to the virus.
So let's look at we had them on the screen, those symptoms to look out for, because it's important that we make parents and people aware of themselves as well, because I mean, as you say, I could pick it up and you know, you don't know. So the kind of symptoms, let's talk through those.
Yeah, it's very important. I think the runny nose, the watery eyes, the coughing, sneezing, and then what happens is usually after 3 to 5 days from those symptoms, the rash may develop. So it's a red sort of blotchy rash that can develop, and you can also develop what are sort of white tiny spots inside the lining of the cheek. So that's something to look out for as well. So there are a number of symptoms. Some initial symptoms are very much like your common sort of colds almost, and can be hard to identify immediately. But when that rash comes in, obviously that's a concern and should be reported immediately.
So what has UNICEF actually done with regard to responding to the outbreak so far? I mean, let's have a look at that. How are you helping as an organization as well as the government?
Yeah, so we're working with the Department of Health really to strengthen the systems, so the health systems, supporting the cold chain vaccination systems, but also to get communication out to communities. So we have what is called the truck. It's a multimedia sort of messenger on wheels that's accessing hotspot locations. It's providing information about measles, what we're talking about today. What are the symptoms to look out for? Where can you go to get your vaccine? Do you have your Road to Health booklet? But it's also the truck accesses provinces, it accesses districts, and it also brings with it community health workers. So engaging with communities on the ground while disseminating this vital communication. Because there are gaps. A lot of people, parents, caregivers, may not know that their child has missed this vaccine, the measles vaccine. And it's really getting that out to communities so they understand where they can go and when to get it.
Yeah, very important. It really is. It's something that we need to be on top of. But, there's also, I mean, we were chatting about it or before the interview. We were just saying, I remember enrolling my kids into school, or in whether it be from a grade R or into their junior school, you had to provide that vaccination certificate. What's happened there? I mean, surely that's, there are obviously people that fall through the system, but there are ways to keep checking. Is that still in place? Well, how is this happening?
Yeah, you're right. There are ways to check, and I think things do fall through the system. I think what you raise is an important point, because it's not about just a health response. It's about a response across sectors. So working with the education system to make sure teachers, to make sure parents are aware within the education system that when the routine immunizations are, through early childhood development practitioners, and bringing in the sort of whole of community response, as we could say. And that's not only in making sure that children get the vaccine, but it's also making sure that we can then quickly identify cases when they occur, and then we can help to refer those cases to health facilities. So it's really across the board, from parents, caregivers, to educators, to early childhood development practitioners, and to community health workers and others.
Yeah, indeed. And then just finally, I'm hearing or understand that the governments of Germany and Japan have actually provided some support in this issue. What is their involvement to this outbreak?
Yeah, that's right. So what we saw during COVID was some governments like Germany and Japan have been very generous in providing support through UNICEF to the Department of Health to strengthen the cold chain management system, but also to strengthen the vaccination system more broadly. So when we put in place, technical assistance, look at the management, how is the supply chain working of vaccines? That's not just about the COVID response, because this came from the COVID response, but it's about broader strengthening of the system on any vaccination, and particularly routine childhood immunizations, which are so important to protect young lives and has done so much over the years to save many millions of children's lives.
All right, Toby, let's leave it there. Thanks so much for talking to us here on the program. That, of course, was UNICEF South Africa's Chief of Communications, Toby Fricker, talking to us about the latest measles outbreak in South Africa, where the number of confirmed measles cases has risen to 169 across 4 provinces. Perhaps I can ask the team just to put those symptoms back up on the screen, and we can take you into an ad break with those. So if you see or feel any of these symptoms, or you see particularly your children having these symptoms, just take them to go and get looked at. You never know. This could be a case of measles. And measles is one of those unfortunate diseases. If you do pick up, you can die from this. So that's something you need to keep in the back of your mind. So just look out for it, get attention, and make sure that you get the medical care for it.